There's a very strong relationship between dementia and epilepsy. So people with dementia have a very high risk of having seizures and epilepsy. Some estimates have been as high as 80 to 90 times the risk of people who don't have dementia. So we know that dementia can result in epilepsy, and obviously with the growing population, elderly population, there's an increased rate of dementia-related epilepsy. But there's also a separate consideration that many people with epilepsy develop cognitive decline, and also many people with epilepsy have a sort of pathology that we see in dementia when you actually look at their brains after resection, after surgical resection. So there seems to be a very strong, perhaps two-way relationship. So people with dementia having an increased risk of seizures, and then people with epilepsy having an increased risk of cognitive decline. So tau is a critical protein within the central nervous system, and it forms microtubules which are necessary for the sort of scaffolding and communication that occurs within neurons within the central nervous system. But tau can get phosphorylated, and the phosphorylated tau, or certainly hyperphosphorylated tau, can form abnormal collections of tangles that are associated with a whole host of neurodegenerative diseases. So there are a number of neurodegenerative diseases where you have abnormal tau and tau accumulation and associated dementias such as frontotemporal dementia. But also you start to see tau in other circumstances such as after traumatic brain injury. And there's now growing evidence that you can see tau in people with epilepsy who don't necessarily have had trauma to their brain. So tau accumulation or hyperphosphorylated tau seems to be associated with injury to the brain, with primary dementias, and also with epilepsy. So I think there are a number of very important observations that may direct treatment strategies in the future. The first of which is that cognitive decline in people with temporal lobe epilepsy who've undergone temporal lobe resection seems to be correlated with the amount of tau that you see in the tissue after resection. The other things that seems to be important is that in many people with, or possibly in many people with dementia, with Alzheimer's, that there may be subclinical seizures that are not apparent or not even apparent on scalp EEG. And that those seizures may be occurring very early on in the disease. And the third important aspect to this whole story is that when you look at injury, there's accumulation of phosphorylated tau afterwards. And in animal models, certainly, it's been shown that if you dephosphorylate that tau, then you may be able to prevent both the cognitive problems that follow injury and also the development of epilepsy. So taking all those things together, I can see that there are three different strategies that may be important. The first of which is that targeting tau after an injury may prevent the development of epilepsy. And as I say, there's growing preclinical data to suggest that, and the sort of drugs that may be important in doing that could possibly be easily translatable into human trials in the near future. The second aspect is whether treating those subclinical seizures that people have in Alzheimer's may in fact slow down the progression of Alzheimer's and may be a very easy sort of druggable target for the treatment of Alzheimer's that at the present moment is not being investigated. And the third aspect is whether treating the acute tau accumulation that occurs in epilepsy may in some way prevent some of the cognitive decline that we see in association with epilepsy, independent of the number of seizures that people are having. So I think tau is now being seen as possibly playing a key part both in the consequences of epilepsy, in epileptogenesis, so the development of epilepsy, and also in the development of comorbidities associated with epilepsy, in particular cognitive decline. And these data are burgeoning. So in recent years, there's been very high-profile papers indicating the possible role of tau in all these situations. And I'm hoping that in the near future, we're going to have some therapies that can go into clinical trials to see whether it has an impact on both dementia and also on epilepsy.